Do you take thyroid medications like Synthroid or levothyroxine or Cytomel or Armour, and no matter what adjustments that your doctor makes to your thyroid replacement, to the dosage, you still struggle with these horrific thyroid symptoms? And it feels like your thyroid medications have all of a sudden stopped working? Well, this is something I hear from patients every single day. And if this is you, I want you to stay tuned. Today I'm talking about the reasons why it feels like those thyroid medications are no longer working. And guess what? It's got nothing to do with the kind of thyroid replacement that you are taking. I'm Dr. Hagmeyer, and I'm the clinic director here at drhagmeyer.com, where we specialize in helping patients from around the world find answers and find solutions to some of the most chronic and most challenging thyroid problems. In today's video, I want to share with you 10 of the most common reasons why your thyroid medication is not working and why it never will until you address these 10 reasons. Now, at the end of this video, I'll share with you some very, very important tips, additional tips that I believe will just have a huge impact on your thyroid gland. So be sure to watch this video all the way to the end, all right? Now, if you've already subscribed to my YouTube channel, be sure to do that. If you haven't done that, do that right now, as well as hitting that notification button. You know, every morning I wake up and I check my emails and I read 20, 30, sometimes 40 emails from patients who have been diagnosed with thyroid disease. And most of them have been on thyroid medication for months. Sometimes they've been on them for years. Many have Hashimoto's, many have Graves', and some of them have had their thyroid glands removed. And all of them want to know what they need to do to feel better. They still struggle with fatigue and brain fog and depression and anxiety and weight gain and headaches and chronic pain and gut issues despite taking their thyroid medication. Now, before I explain what you need to do, I want you to know this. I know on the surface that it seems that if you could just get your thyroid medication dialed in to that proper TSH level, into that normal range, that would fix all your problems, right? Everything would just fall into place, right? The weight would just start melting off your body, the brain fog would be gone, the anxiety, the depression, they would all vanish, and you would jump out of bed in the morning feeling just refreshed and energized. Unfortunately, if you took a survey of all the doctors who treat patients with thyroid hormone replacement and you asked those doctors, how many of your patients feel great being on thyroid replacement, being on different kinds of thyroid medication? You'd probably find an incredibly low number of doctors who would tell you that their patients report feeling good despite being on the thyroid replacement. All right, most are still going to suffer with unresolved thyroid symptoms. So let me peel back and explain why this is happening to you and give you some of the most important areas of your health that you really should start focusing in on. And if you implement some of these things and you work with a functional medicine doctor, I promise you that it will change your life, and I promise you that you will start to feel better. Now also, if after watching this video you want more information on any of these topics, I'll include many links and articles and videos for each area. All right, so at your own convenience, you can go back, you can explore any of these areas that you're more interested in on your own. So let's jump into reason number one that your thyroid medication is not working and you feel lousy, right? So number one is you have multiple vitamin deficiencies. Now listen, most patients with thyroid disease find themselves with various vitamin deficiencies, right? We're not just talking about vitamin D or B12, but also many different kinds of antioxidants and minerals and amino acids. And while no one vitamin deficiency or even amino acid imbalance all by itself is causing your thyroid symptoms, chances are you have multiple vitamin deficiencies. And so it's really this combined effect of these vitamins and minerals and amino acid deficiencies that are really contributing and one of the reasons for your low thyroid symptoms. Now let me explain something. Again, some of the most common deficiencies seen in thyroid disease include vitamin A, vitamin D, vitamin K, zinc, selenium, iodine, iron, and of course, many of your B vitamins. So these are going to be things like B2, B3, B6, folate, and then B12. Selenium and zinc, for example, are very important because they help convert T4 into T3. Iron, zinc, vitamin D, and your B vitamins, so B2, B3, B6, and folate, and B12, these all help make thyroid hormones. Vitamin A, on the other hand, this is a vitamin that's actually needed for improving the cellular sensitivity to thyroid hormones. So don't underestimate the power of these vitamins and these minerals and these antioxidants, right? Deficiencies in any of these, and you're not going to have optimal thyroid function. All right, reason number two. Number two, the second reason why your medication feels like it's just stopped working and you feel lousy is that you're sensitive to some of the binders, the fillers, heavy metals, or sometimes the gluten and dairy and corn that are found in your thyroid medication preparations, right? Gluten sensitivity and celiac disease, all right? These often go hand in hand with thyroid disease and Hashimoto's and Graves' disease. Cytomel, which is a T3 thyroid preparation, this is made by Pfizer, and it uses a starch, which is used to really bind this medication together. And the starches that are used often, most times, are going to be wheat, which is basically your gluten, and corn, right? Levothyroxine, on the other hand, this is a T4 thyroid replacement. And this also contains gluten and corn, but it also has things like sugar. It has all kinds of dyes. It has aluminum in it. But what if you're sensitive to some of these binders and you're sensitive to these fillers that are found in these replacements, like so many people are? What if you're sensitive to wheat and dairy and corn, and maybe you just know that aluminum is not good for you? Well, worst case scenario, you are most likely going to have a flare-up of your immune system. This is going to cause more damage to the thyroid gland. This is going to lower your thyroid levels. This is going to cause your thyroid not to work as well as it should. And lastly, it's going to cause or develop new symptoms, or it's going to exacerbate the existing symptoms that you already have. And maybe you end up with hives. Maybe you end up with migraines. Maybe you end up with different kinds of skin rashes. Maybe your gut becomes more irritated. Maybe you feel heart palpitations, or you have trouble breathing, or you experience muscle pain or stomach bloating and IBS. Maybe you just feel worse in general, right? If any of this really just resonates with you, I suggest you cross-reference the medications that you're taking and go to a website. One that you can use is called rxlist.com, or some other similar website which lists the many different kind of medications and the ingredients in those medications, all right? Be aware of those. Reason number three that your thyroid medication feels like it's stopped working and you still have thyroid symptoms, this one really comes down to your digestive system and the health of your gut. Now, have you ever thought about your digestion and how it might be linked to poor thyroid function? Let me explain a few things here, things that I think are just so important as it connects the relationship between the thyroid and gut. Now, when it comes to digestion, gut health and thyroid function they're interwoven, and they're interwoven in so many different ways, right? If you can't break down food because you have poor liver or poor gallbladder function, or you have poor pancreatic function, or you don't have enough hydrochloric acid in your gut, again, all things that are incredibly common in people that have thyroid disease and Graves and Hashimoto's, then you're not going to optimally extract your nutrients from the foods that you eat. And this is going to lead to nutrient deficiencies. Again, inevitably, you're going to develop these nutritional deficiencies, and depending on the vitamin or the mineral or the antioxidant that you're having trouble with, now that can lead to a whole host of new symptoms in addition to suboptimal thyroid function. The second problem that we often see in patients with thyroid disease is gut infections, right? This is such an important area that I did an entire video on 10 of the most common gut problems seen in patients with thyroid disease. When it comes to infection, this might be a yeast overgrowth, this might be a fungal overgrowth, it might be a bacterial overgrowth like SIBO, small intestinal bacterial overgrowth, or it might be an infection like H. pylori. Many of these infections are caused by long-standing problems with the insufficient production of what we call proteolytic digestive enzymes, right? This is like essentially hydrochloric acid. And like I just mentioned just a moment ago, if you have problems with liver, gallbladder infections, again, you're not going to have optimal thyroid function, all right? Now, before I move into the next area, I want to say one more thing here as it relates to digestion and thyroid disease. And this one is really, really important. If you take Synthroid or you take levothyroxine, which contains only T4 hormones, and your body essentially needs to take this T4 and it needs to convert it into T3 thyroid hormones, right? This is T3 is your active thyroid hormone. And I was just talking about this with a patient this morning. And she was asking, well, do you prescribe T3 thyroid replacement? And what I had to explain to her is what I'm going to explain to you right now. If you have problems, right, with digestion, gut bacteria issues, inflammation, or your liver is stressed out by just toxic overload, taking more and more T4 will not fix the problem, because the problem really is a conversion issue. You're not converting T4 into T3. And at this point in time, again, because it's not a T4 issue, or even a T3 issue for that matter, it's the problem with converting T4 to T3. Taking these replacements without addressing the underlying root cause is never going to lead to success. And again, this is one of the most common patterns of thyroid disease that I see day in and day out, is this poor conversion issue. I see this in patients where, again, we see low T3 levels, we see low free T3 levels. And again, one of the main reasons for this low T3 is what we call thyroid underconversion, right? This might be another reason why your thyroid medication is not working. Your doctors are simply putting you on T4, your body's not converting it because of those things that we just mentioned. All right, next reason here, this one really has to do with adrenal dysfunction, right? Sometimes you'll see this being related to as adrenal fatigue or HPA axis dysregulation. This is a very, very common culprit for poor thyroid function, right? It's a common problem in both men and women that have hormone imbalances. And part of the reason why this is such an issue is that poor adrenal function is related to stress, right? Chronic stress is no stranger to those people who suffer with thyroid disease or any other chronic health problem for that matter. But the stress hormones, like cortisol and DHEA, they have a tremendous impact on thyroid function. Too much cortisol, too little cortisol, or too little DHEA, this again just poses so many problems for thyroid function, right? When I think about the reasons for poor adrenal function, and I think about things like chronic stress, or I think about fluctuating blood sugar levels, I think about infections, I think about inflammation, I think about excessive exercise. That's right, excessive exercise can stress your adrenals. So can yo-yo diets, where you're restricting foods too heavily, or excessive dieting, or even a disrupted sleep cycle. These are all the things that can affect your adrenal glands. This morning I was on the phone with a patient who, again, that same patient I was referencing, had Epstein-Barr virus, right? So again, viruses can also affect your adrenal glands. Now, if this is you, supporting your adrenal glands and identifying the level of these hormones will go a long, long way in helping you uncover why your thyroid is not functioning well, but also how to support your thyroid gland for optimal health, right? When the adrenal glands are properly supported, it can have far-ranging effects on your body, including things like sleep, anxiety, concentration, better metabolism, stamina, bone health, weight loss, the heart, and even improved brain function, right? My website has tons of information on how to support your adrenal glands, how to make these lifestyle changes that can help, all right? Reason number 5, right, that your thyroid medication feels like it just stopped working and you still feel lousy after all of this, comes down to a toxic, overworked, stressed, congested liver, right? I mentioned this earlier, but your liver is involved in over 300 different functions, right? It filters blood from the digestive system. It's involved in cholesterol production. It produces bile, which helps you eliminate toxins. It processes hormones. It cleans and purifies the blood. It produces all kinds of enzymes, and the list goes on and on and on. Trust me, I'm not going to list all 300, right? But it's also the place where 60% of that T4 thyroid hormone is converted into active T3 thyroid hormone, right? So it's a pretty important area that needs attention in patients with Hashimoto's and patients with Graves' disease and patients with hypothyroidism. You see, many medications that people take alongside their thyroid medication puts additional stress and strain on the liver. Medications like aspirin and Tylenol and Excedrin and antidepressants and anti-anxiety medications and antibiotics and birth control pills and statins, which are cholesterol lowering, and synthetic estrogens like those seen in hormone patches and HRT. All of these put stress and strain on your liver. Your liver has to work twice as hard when you're taking all this medication, right? So you don't want to make your liver have to overwork. Now, the icing on the cake is the standard American diet that's loaded with sugar, loaded with caffeine, loaded with preservatives, loaded with dyes, loaded with pesticides, patients skipping meals on a daily basis. Again, these are all things that will affect your thyroid health. One of the things that I say over and over again with prospective patients is that a successful treatment of your thyroid disease requires an understanding of what your big picture is, right? So this is why I always talk about this big picture approach. You have to think outside of the box, or in this case, you have to start thinking outside your thyroid gland. Many times the thyroid is dysfunctioning not because of a specific problem with the thyroid, but problems outside the thyroid. So that's why we have to look at this big picture. Now, again, think about this. If it was just your thyroid, you should be able to take your thyroid medication. You should feel good. You should call it a day. All your symptoms would be gone, right? But my bet that you're still watching this video because that's not happening with you. You're still struggling with all those symptoms. And so again, there's so much more going on than just taking thyroid hormones. I wish that was something that every single patient who has thyroid disease or is taking thyroid replacement, that is one thing that I wish I could instill in their memory banks, right? If you're serious about healing your thyroid gland, you have to understand that you need to heal the whole body, not just the thyroid, all right? So reason number 6, high reverse T3 levels, right? This is a huge one. The thyroid gland, again, it makes that T4, it makes that T3, and it makes small amounts of something called reverse T3. So under periods of chronic stress, low-calorie diets, malnutrition, poor absorption, excessive cortisol production, exposure to heavy metals, or severe illness, your body will make T4 and it will convert it into reverse T3. Now, here's the problem with reverse T3. Reverse T3 is not the same as T3 thyroid hormone, right? When you have high levels of reverse T3, those high levels of reverse T3 are going to block your thyroid receptors that are designed for T3 thyroid hormone. They're not meant for reverse T3. And so the end result is when you have these high levels of reverse T3 is you're going to have low thyroid hormone levels, right? You're going to experience those low thyroid symptoms due to that high reverse T3. Now, if you have a doctor who ran a comprehensive thyroid panel and you have your reverse T3 levels and you have your total T3 levels, then you can calculate what's called your T3 reverse T3 ratio. And this is something that I highly recommend that you do if you have these markers done. And again, if you visit my website and you plug in your values, you can find out why this ratio is important, what causes the high levels of reverse T3, and also some things you can do to start lowering it. All right. There's also a nice video on that page that really just explains where you want those levels for optimal thyroid function. All right. Now be sure to check the description box of today's video because I will be posting some very important links in that section for you to go back and review or watch it at your convenience. Now, reason number 7 that your thyroid feels like it stopped working, and the symptoms outside of poor thyroid conversion. And let me explain this a little bit more. Earlier that I mentioned that the thyroid gland makes T4 and it makes T3 and it makes small amounts of reverse T3. Well, again, that T4 is the inactive thyroid hormone. It doesn't do a whole lot. And this is the reason it needs to be converted into T3, right? T3 is approximately 4 times more potent than T4. And again, there are many, many reasons in which your body doesn't take that T4 and convert it into T3. But if you have low total T3 levels, or you have low free T3 levels on your blood work, I recommend that you read some of the articles that I have written as far as the common causes of low T3 and low free T3. Right? If you're a person who can't convert T4 into T3, your doctor will try to increase your T4 levels, or they will add another thyroid hormone that contains T3 replacement, perhaps sometimes like Cytomel or sometimes like Armour. But guess what? Again, taking this additional T3 thyroid hormone still does not address the root cause of why you have low T3 or why your free T3 levels are low in the first place. In other words, it doesn't address the root cause. You might feel a bit better temporarily, but once you stop taking the T3 thyroid hormone, you're going to be back to feeling lousy. In addition, adjusting T3 levels in itself has unique challenges because, again, T3 doesn't last in your blood very long. It has a shorter half-life than T4. And it's also the reason why your best strategy to identify, or I should say, this is the reason why the best strategy at addressing this T3 is finding out why you have low T3 in the first place, right? It's always best to work with a functional medicine doctor here who can investigate these reasons as to why these issues are present, right? Reason number 8, you're the 1 in 11 people in the United States who unknowingly has a blood sugar problem. Right? Don't overlook the importance of healthy blood sugar, right? Healthy thyroid function, again, is interwoven with your blood sugar levels. And again, blood sugar problems are rampant among Americans, but they also pose a huge problem for those who are suffering with hypothyroidism and Hashimoto's thyroiditis, right? It's one of the main reasons we see things like high cholesterol, high triglycerides, high LDLs, which are your bad cholesterol. It's a reason why we see low HDLs, again, which is your good cholesterol. These are some very common scenarios that we see in thyroid patients. And again, it's important to understand that whether you have high or low blood sugar, you probably have some degree of insulin resistance, right? Now, insulin is also connected to weight gain, right? And here's why. And this is, again, a common problem that people with thyroid disease suffer with, right? Is that stubborn weight gain, right? So again, insulin is a fat-storing hormone. And what that basically means is it takes the sugar from the carbohydrates that we eat, and insulin shuttles glucose, or that sugar, into the cells for energy. Again, insulin resistance occurs when the insulin receptors, they don't listen or they don't respond to insulin. And consequently, your sugar levels in your blood go up. And as your sugar levels go up and up and up and up, you feel fatigued, you gain weight, you have brain fog, and again, you start to put on this weight because of this insulin resistance, right? Now, the other thing is that insulin resistance, insulin levels, I should say, by themselves are the root cause of many disease processes. We know that insulin resistance drives heart disease. We know it drives polycystic ovarian syndrome. We know that women with fibroids often have insulin resistance. We know that all kinds of hormonal imbalances and leptin resistance and even cancer are all tied to elevated blood sugar levels. As in the case of insulin resistance and diabetes, it's another contributing factor to having those low T3 levels, right? So, insulin resistance. When I think about insulin resistance, if you have fasting blood sugar levels over 100 in the morning, you have elevated triglycerides, you have low HDLs, which again are those good cholesterol, then there's a very, very good chance you are, again, 1 in 11 Americans with insulin resistance. And the scary part about this is that 1 in 11 people don't even know that they're insulin resistant. So this is something that I want you to be aware of. Reason number 9 is you have Hashimoto's disease, right? Now, Hashimoto's disease is by far, it is the number 1 cause of thyroid disease in the United States, right? Low iodine is not the number 1 cause of thyroid disease in the United States. When anybody hears hypothyroidism, immediately they start thinking iodine. But let me say this again. Iodine is not the number 1 cause of hypothyroidism. It's Hashimoto's, which again is that autoimmune disease. And again, it frequently goes undiagnosed. And here's why. A standard thyroid panel does not test for this. So unless you beg your doctor to run antibodies against your thyroid, or you visit a functional medicine doctor, chances are your doctor is not going to order those tests, right? So unless your doctor has ordered a more comprehensive thyroid panel, these antibodies don't get checked, and this diagnosis of Hashimoto's disease often goes undiagnosed for years. And again, during those years, day by day, week by week, month by month, year after year, your immune system is destroying your thyroid gland. The way Hashimoto's is diagnosed is by having thyroid antibodies tested. Now, there's 2 antibodies that I tell people should be tested. One of them is called thyroid peroxidase antibody, and the other is antithyroglobulin antibodies. These are called TGB antibodies, right? Unfortunately, in about 15 to 20% of the population, these antibodies can still be negative despite having Hashimoto's disease. So again, if antibodies are negative, but you have problems swallowing, or you notice a nodule or a lump in your neck, I recommend that you get an ultrasound. Now, there's several reasons to be concerned about nodules, and I discussed them in a video that I've done a little bit a while back. when you need to be concerned about thyroid nodules. So if that's something that you can relate to, again, go back and watch that video. Now, if you have Hashimoto's disease and you've already been diagnosed, your focus, your entire focus in terms of a successful outcome and feeling good again and stabilizing your thyroid gland is going to need to focus on your immune system. In other words, identifying the reasons why your immune system is attacking the thyroid gland, right? Your problem is not really your thyroid, but rather all of the things, the imbalances in your immune system, the metabolic conditions within your body that are triggering your immune system to destroy the thyroid gland, right? If these autoimmune triggers are not addressed, usually within a 10-year period of time, you're going to end up with another autoimmune disease. So if this is you, go to Google, type in autoimmune triggers, Dr. Hagmeyer, and start reading many of the different articles and the videos that I've done on this particular topic. Because thinking that you're fixing your problem with thyroid replacement, and again, I don't care if it's T4 or T3, if it's natural or synthetic, that's a very, very small part of understanding this autoimmune component to thyroid disease, right? There's an entire section on my website that's dedicated towards autoimmune testing. And this is just a huge, huge area, right? It's the reason that I think many people that have thyroid disease, they never get better, is because the underlying autoimmune component never gets addressed, right? The reason that's important, again, is identifying your individual triggers will help you make the lifestyle changes and just the necessary steps with information that will help you support and stabilize your immune system. And the last reason number 10, that thyroid medications feel like they've stopped working is thyroid receptor sensitivity issues. Now, when your body is inflamed, all right, it can blunt the sensitivity of these receptors on the cell membrane that take the thyroid hormone and they allow it to go into the cell for the cells to use them. It can also reduce the number of those receptors. This is called thyroid receptor downregulation, right? When the receptors, or I should say when the receptors are downregulated or when the sensitivity of those receptors go down, they become blunted, they become downregulated, you often have all the symptoms of low thyroid, Hashimoto's, hypothyroidism, but surprisingly, some of you out there may have very normal TSH levels. Again, this is a common culprit for the downregulation or the blunted receptors, is that inflammation, all right? Things like infections can also cause it. Vitamin A deficiency, zinc deficiencies, okay? So these are all things that I think about when I think about thyroid receptors being downregulated or thyroid receptors not allowing thyroid hormone to get into the cell. Now, I realize that we've covered a lot of information in today's video, so I want to leave you with just a few final tips, a few final thoughts, and really just takeaways from today's video. So number one is thyroid replacement is not a magic bullet, right? It won't fix any of the problems that I've talked about in today's video. And this idea that thyroid replacement is this magic pill has to stop. Number two, remember, just like the other systems in your body, your thyroid doesn't work in a vacuum. All the systems of your body, they work together. Your digestion, your liver, your gut microbiome, your sex hormones, your adrenal glands, your nutrition, your diet, all of these things influence thyroid function. And therefore, if you are serious about getting your health back, if you're serious about optimizing thyroid function, you have to start paying attention to these areas of health, of those systems, if you want vibrant, long-standing health, okay? Number three, I hope that watching after today's video or reading the transcript of this video on my website, that you'll walk away with a much better understanding and hope that there is so much more you can do to improve your health. Thyroid medication is not a cure, and for the vast majority of people that are out there or that might be watching today's video, thyroid medication at best is a crutch. If you need to take thyroid hormone medication, either because maybe you've had your thyroid gland removed or because you have an autoimmune disease like Hashimoto's and there is permanent destruction to your thyroid gland, the things that I talked about today in this video and other videos, if you watch them, are still very relevant and will just have a profound impact on your health if you address them, right? If your doctor doesn't understand these things that I talked about and your approach and they approach your thyroid condition not in a methodical fashion, I guarantee you'll continue to get sicker and sicker. But on the other hand, if your doctor is methodical and does address some of these things that we've talked about today, I guarantee you that you will see drastic changes in your life. Number 4, if you need help and you're looking to address this big picture that I keep talking about throughout all my videos, all right, reach out to my practice, okay? At drhagmeyer.com, I have a team of healthcare professionals that will teach you how to strengthen, how to support your body so that you can avoid, you can decrease, and sometimes even wean off many of the unnecessary medications that you might be taking that are hurting or even harming you, all right? We're here to help you. And finally, visit my website, take my thyroid quiz. This quiz will provide you with invaluable information regarding your thyroid. If you like, you can also opt in for my thyroid newsletter, which will help you further understand how to improve thyroid function. And again, if you're looking for a personalized one-on-one help, you can take the next step, which is to complete my health questionnaire under the Start Here button, all right, the Start Here tab. And once completed, someone from my office will send you out an email with several recommendations on where we recommend that you start. Again, a starting point for you to become a new patient. All right, so there you go. 10 reasons why your thyroid medication feels like it stopped working and why you still struggle with those unresolved thyroid symptoms. If you like today's video, share this information, comment, like, and again, be sure to hit the notification button so that when we update new videos to our channel, you will be